and their time, but we feel that it's important to hear from them and to be able to share some of the knowledge that they have to the community. Jeff is our County Health Department Service Manager here, or that's probably not your correct title, but you can correct me there, Director. But share with us a little bit about what you're seeing and what you've learned and what's changed in the last 30 days or so.
Yeah, well, thank you, Mayor. Kind of like to hit two main areas today. One is really clarification on the governor's executive order, actually the last two that have come out, and then talk about the community spread and how we can reduce the risk in our community. On the governor's executive orders, it's super busy information right here, and I'll walk through it. But there's some confusion based off of masks. That's our biggest question that we get asked right now. Based off on the governor's executive order 2040, restaurants, lounges, and businesses are required to have their staff who interact with the customers wear face masks, regardless of a city, county ordinance or proclamation. So we just ask that we, encourage all the establishments to comply with that order. And our staff, our environmental health staff, are out in the public. We're providing education and doing the best that we can to get all of our establishments in compliance. And then the most recent executive order, 2020-43, really focuses on the pausing of operations for certain entities. Bars who hold a Series 6 or 7 liquor license, and that is their primary sales is alcoholic beverages. Gyms, fitness clubs, and centers, indoor movie theaters, water parks and tubing, and then pools may continue to operate if they prohibit groups larger than 10. So part of our role at the health department is to provide the education to our establishments, to our community, and help them through education on how to comply. As far as the virus, it's exploding in our area. The progression of cases, if we look at February through May, we had 1,833 cases in Navajo County. In the past 30 days, we have increased to a total of 3,625 cases. So 49% of our cases have occurred in the past 30 days. That's a trend that we don't want to continue. And as you can see in our map, the virus is everywhere. It is in every community. It's in every neighborhood. It's in our backyards. And we just need to take those precautionary measures to prevent the increases and to slow the spread. So what can we do? As I mentioned, it's widespread. It's everywhere. And the goal through these mitigation measures is to slow the spread. There's no way to prevent it or stop it completely. These are all tools to help slow the spread. And if I could focus in on one area, I'd really like to talk about staying home when you're sick. Many of our cases that we have currently, we epi-link them back to a situation where somebody came to work and they still weren't feeling very well. So this is not the time to try and push through it. If you wake up, you're feeling off, it is safer to stay home. Let's give it a few hours, see how you feel. Call your provider. They'll give you some advice on whether to, come in and get tested or to wait a little bit longer and see how your symptoms progress. But if we could do that one thing, we would have a significant impact on slowing the spread in our community.
I think of being allergy season, being different things. People wake up, they might have a little dry throat. They think, oh, this isn't a big deal. Or maybe they have a runny nose. And in those conditions, let's be safe. Let's call our employer and say, hey, I got to take 6 hours or half a day or tomorrow before I I come back. Just take that extra precaution and let a little bit of time cover.
It's definitely safer to be on the cautious side of this. Yes. And then, continuing with the reducing risk. And each one of us can do our part to help reduce the risk. And physical distancing and staying home as much as we can are the best tool. But if we do go out in public and we cannot control that physical distance, wearing a face mask or face covering will dramatically lower your risk of being exposed. And if you see on the graph, it's really a community-wide effort. We all need to be wearing masks when we're out in public, because my mask is protecting you, and your mask is protecting. So who do we wear a mask for? That's the question. As we look at the data and the demographics of who are the highest infection rates right now, and we're looking at the 22 to 44 range at the highest percentage of infections right now. And looking at the data, more than likely they will not have a severe reaction to the virus. But by that age group having it, they're a carrier, and then they spread the virus. So who are we wearing the mask for? We're wearing it for our loved ones at home. We're wearing it for our neighbors, our coworkers, our community. And if we all wear a mask and we're all wearing it for that person in our life that we would hate to spread this disease to, we will have a significant impact on slowing the spread.
Appreciate that. One of the things I've appreciated with you, Mr. Lee, that you, when this first came out, we'll go back to late February, early March, when we first thought that we potentially had some cases. I remember our concern, because we were so early, we would probably make national news at the time. And we tested, I think, 7 people at that time. And luckily, to our surprise in a little bit, they all came back negative. And that was something that was a great relief for us. But you always said that it's not a matter of if we will have this in our community. It's just a matter of when. And I think now we're starting to see the when. We're starting to see it's here. It's been delayed some. There's no rhyme or reason why it's been delayed in Arizona, but I think it's quite obvious that we're seeing an increase. I wanted to ask Mr. MacArthur if he'd just share with us a little bit about what's going on here in our local hospital, some of the challenges that you're faced with. We just want to thank you for your assistance and the nurses and the doctors that are working there. They're in harm's way every single day. And we just really appreciate your efforts and everything that you're doing. And we appreciate you working with the county, working with the city, the state, to try to keep us safe and mitigate the cases that we have. But share with us some of your challenges and what we can do to help, and some advice that you have.
Yeah, one of the things we did early was to establish an incident command team made up of key players, physicians, as well as senior leadership to kind of manage the COVID crisis. We were meeting every day. Now we're meeting about twice a week, but reporting on what's going on, number of cases, employees, what's happening in the hospital, what's our bed capacity. We geared up back in March when the governor issued the initial executive order to increase your surge capacity by 50%. We did that. We identified 24 beds in addition to the 101 beds that we were licensed for. We brought in extra staff, all set, and we canceled all our outpatient surgeries, which was a tremendous financial hit to the hospital. And then nothing happened really. March, April, May, we ended up, our revenues took them, we're going to be down 50 million through the first 6 months of the year. We sent back all the agency nurses we had because they weren't needed. Our volumes dropped 20 to 30%. And then Jeff said, come June, the explosion hit. How we're running today on any given day in the hospital, I have an ICU unit, 12 bed, that's totally dedicated to COVID, and it's full every day, either COVID or COVID rule outs. My med-surg first floor has 18 beds on it. It's full every day. COVID or COVID rule-outs. We sometimes spill over on our second floor. We've opened up 5 additional ICU beds in our surgical area. We've ordered 26 more nurses to come in to open up more beds. Any given day, we're 18 to 20 COVID patients in the ED. So we're at bed capacity every day. We hold patients every day in the ED waiting for discharges. And so one of the misconceptions out in the community, it's not here on the mountain. Well, it is here on the mountain. It's hitting in a big way. It's hitting my staff. I mean, we get pushback every day that we require masks to be worn when you see a physician. And we had to have police come and escort a person off of Bison Ranch today who refused to leave. We offer telemedicine for patients that don't want to be seen, but we're trying to protect our doctors. I've had 3 doctors out and a bunch of other providers and 25 of my hospital staff out with COVID because they're being exposed, not by patients that are bringing that in. So we require masks to be worn. But we'll have, beginning next week, we'll be opening more beds. It takes a while when you ask for, everybody wants agency nurses now, and it's hard to get them. Jeff has really helped us using there's a national volunteer line where we can put out an order on, and we asked for 26, and we got 20 calls the next day after Jeff approved it. So we're in the process of hiring them. But our staff's ready. I mean, we were all nervous when initially, we're going to get a COVID patient, and it didn't quite happen. And when we got 1 or 2, everybody got nervous. But now we're in a routine. We're dealing with it every day. And 40, well, probably 50 patients every given day at the hospital with COVID or COVID rule-out. So it's here.
Right, right. You know, that's something that I appreciate you sharing that with us, being able to help our public know that we're not going to escape this, that it's here. And the things that Jeff has shared with us, to be able to take some of the precautions that you can do, the measures you can have. And I think it's one of the things that we're really trying to help businesses understand, that if they're coming in contact with patrons, that they just need to be doing everything they can. The other alternative is we go back to, you know, we have paused already some of the functions that were going on. And I think that's the last thing any of us want to do economically wise, is see us take another complete shutdown of our economy. That isn't good for anybody. And I can tell you, if it does come to that, it will be a more difficult and a more mandatory type shutdown that will cease almost movement in some communities. So I by no means am mandating or asking for that, but that could be the alternative. I had an opportunity of sharing a conversation this afternoon, and it's interesting as I hear things that first come out of Washington through Senator McSally, Senator Sinema, and also our Representative Tom O'Halloran. They're about 3 weeks to a month ahead of what we're seeing even here of issues and things that are happening. They have been asking for and advising mask and social distancing. They're still the preferred method of social distancing, and at all possible that you can do that. And then the other is, there's no way that you can feel that you can go in and out of a store without ever coming in contact, close proximity with somebody. When you check out or something, unless you're self-checking out, you're going to come into proximity with someone, and you need to be prepared to be able to mask up. And I think that's so if you're going to do it, just be extra cautious of doing it beforehand, and that's something that's helpful. I just want to give businesses a little bit of insight. Senator Sinema just shared with us that she's working on the PPP forgiveness to the businesses that had some financial assistance given to them. I want to get this right, but 80% of all of the PPP loans that were made were under $150,000. But it was only 20% of all the monies that were distributed. So 20%, so 80% of all the money was over 150,000, and it went to only 20% of businesses. So what she's trying to get past, and she's asking that other senators go along with this, is let's not penalize the small business owners any further in routine paperwork and mandatory. That some cases I've heard that it could take 3 to 4 hours and sometimes 3 to 4 days to fill out some of the paperwork to get these loans forgiven. What she's proposing, that anything under $150,000 loan that you received, that the business owner be required to sign an attestation that they use those funds correctly the way it was outlined. And then that loan would be immediately forgiven, and it's a one-page signature and done. But then the people who have over $150,000 that they've received, that they would be scrutinized very heavily, and they would go through very detailed to make sure that that money did actually go where it was because of the sum of it. If you're going to forgive somebody $150,000 or more, you need to make sure that it was where it was used. So that's what they're working on to expedite. They also are waiting for the president to sign a new extension today. And if he does, there'll still be PPP loan funds available up through August. So that's just one of the things that if anybody in our communities still needs some assistance, it's still available there. So if you didn't get a loan or didn't know about it, please contact us here at the city or the county, and we'll make sure that you're able to be in contact with the bank and to be able to make that possible. So there's still funds, still economic assistance that's out there. And, we have the 4th of July coming up here, a big weekend here in a few days. What's some advice of how people can mitigate? We're going to have a big influx of people up here. I think one of the governor's executive directives that came out Monday was that there should be no organized groups larger than 50 people meeting, and that we shouldn't have any larger groups than 10 at any time that we're associating with as a group. So what are some other measures that you guys recommend?
Yeah, so I had the opportunity to go down on Tuesday and meet with Governor Ducey and Dr. Birx from the White House Coronavirus Council, and really focused in on this weekend. This is a huge weekend across the country for gatherings. We all want to come together. We all want to celebrate. And again, this is a time where we need to think through is an event where I can control the physical distance? Is an event with my household contacts? If it's not, is it worth going this year? Should we scale back and do a home event? Or if I do choose to go out, definitely wearing a mask, controlling that physical distancing as much as you can. Just being more cautious about what we do and where we go this 4th of July.
Right. Thank you. Mr. MacArthur?
We're geared up. 4th of July is our busiest ED, or emergency department weekend, so we have staff and, we're prepared to treat patients that come through. So, but of all the holidays, 4th of July is the busiest for us in our emergency room. So we're ready, and we have the staff and we have the beds, but it's tough managing the capacity every day.
Well, I appreciate each of you being with us today and what you shared, and we'll continue to update our citizens and keep them abreast. We do encourage you to go to the local municipality's website or the county website to get your information firsthand from that source. It'll always be the correct source as possible that we understand. And I think that you need to realize that some of your community leaders have information even before it's shared, and we make decisions based upon real-time data, real-time information that we're able to have that's not being disseminated always to the public first. So we just encourage you to stay safe, and be American. Be patriotic, love the United States of America, and as you do so, may you teach your children the importance of our freedoms, our liberties, why we have them, and what they can do to protect and preserve them. And as we do this, may we call upon our Heavenly Father for His blessings upon this nation and upon us as a people, where we're truly blessed to live in the White Mountains. We're truly blessed to be part of this great country which we live in. And I ask you to do so. And I pray that God will bless the USA and the White Mountains of Arizona. Thank you.